I offer my humble pranams at the lotus feet of our beloved Bhagwan, Sri Sathya Sai Baba. Loving Sairams to everyone. Thank you very much for giving up your time and joining today's webinar on COVID-19 vaccine. I pray the webinar will address some concerns about the vaccine and confusion brought on by so-called fake news and will help you make an informed choice. Our presenters today are Dr. Sharavanan and Sister Nirali. Dr. Sharavanan is a GP partner and GP tutor in South East London, New Cross. He has an interest in medical education at medical school and GP registrar levels. He is the former president of Bromley Science Centre and current Region 1 healthcare lead. He has a passion for music, singing and playing a variety of musical instruments and had the golden opportunity to sing and perform in the divine presence of our beloved Bhagwan as part of the Sai Mahima pilgrimages. Sister Nirali is a senior PCN pharmacist for Wellingborough and East Northants. She trained at University Hospitals of Leicester and Kettering General Hospital, becoming a senior cardiology specialist pharmacist. Her key areas being acute coronary syndrome, heart failure, and anticoagulation management. She is also an independent prescriber. She is currently one clinical pharmacist assisting in the COVID vaccine rollout in her area. She is also the Region 4 Healthcare Lead and Joint National Youth Adult Coordinator for the SSIO UK. I now hand over to Dr. Sharavanan and Sister Nirali. Jai Sairam.
My humble pranams at the lotus feet of our beloved Bhagavan Sri Sathya Sai Baba. Sai elders, uncles, aunties, brothers and sisters, Jai Sai Ram to you all. It is my pleasure and privilege to be able to speak to you today with the support of Sister Nirali about the ongoing coronavirus vaccination program, which is being rolled out in your local communities across the country and the world beyond. The biggest vaccination program of its kind in human history. I sometimes find myself describing what we are going through with this pandemic as the equivalent of a medical world war. When I sit and reflect on this statement, I realize that unfortunately I am not exaggerating. This is a fight that is being fought in every country across the world to defend and protect ourselves and our loved ones from this invisible disease. During what has felt like a very helpless time, filled with anxiety and fear, with suffering and death, the landscape is changing. The things that we are able to do to help ourselves and our communities is now growing. This evening's talk is one about hope in a situation where there is still many uncertainties. It is critically important that in such situations that we put our maximum energy into the things that we have control over. In terms of the agenda, we are going to cover some of the basics surrounding this virus that has dominated our lives over the last year. To answer the question, should you have the vaccine? To address concerns regarding safety and side effects, which of the vaccines are available to you right now, and what you should do next. Over the last 1 year, we have all become armchair virologists and epidemiologists as we have observed this new coronavirus infection, which causes a respiratory illness that originated in Wuhan, China, and spread through the world over the course of 2020. To date, we know that over 109 million cases have been identified worldwide, with over 2.4 million deaths attributed to this disease. If we ask the question, have we seen anything like this coronavirus respiratory illness before? The answer is yes. It can be responsible for something as simple as the common cold, but other strains of coronavirus were responsible for the more serious outbreaks of SARS in 2003, which was responsible for 8,000 cases and 774 deaths, and MERS, known to have caused about 858 deaths. These are spread through aerosol particles from an infected person. So let us get to the core of this evening's talk. Should you have the coronavirus vaccine? The short answer is yes, you should. The pathway out of this pandemic lay in ensuring that we are able to protect ourselves by cutting the infection's ability to jump from person to person. You know that this virus thrives on our human nature to want to live in communities and have social contact. Social distancing and isolation are cruel terms that we have unfortunately become familiar with in order to stop the disease from spreading. The real fire breaks come when we are able to stop serious infections and transmissions. And this is at the core of principles of any vaccination program. Already, over 15 million vaccinations have been delivered in this country alone. And yet, there are very concerning trends to suggest that patients from Black and minority ethnic groups, including South Asians, are more likely to decline a vaccine or to have a degree of vaccine hesitancy. There is also a greater refusal rate in patients from lower socioeconomic backgrounds. These are described as health inequalities, and it is the responsibility of every single healthcare professional to fight such inequalities. One of the very concerning reasons for vaccine hesitancy is fake news. Stories with no factual basis being spread, looking to delegitimize and take confidence away from what are very important and logical actions to protect your own health. Yes, there is fear of the pandemic, but there is also a pandemic of fear. These false stories in themselves are spreading like a virus, infecting the minds of the more isolated and fragile within the community with fear and exposing them to risks that they should not be taking. To fight this fear, you need to ask questions and gain knowledge from reliable and trusted sources. This is not only to help yourself, but to help your family, friends, and community. One of the questions I get regularly asked is the vaccine safe? Every medical device, treatment, and therapy is rigorously scrutinized and monitored for safety. This is done by the Medicines and Health Products Regulatory Agency, also known as the MHRA. The vaccines are safe and they are effective. I will now hand over to Sister Nirali to give you some more information about the development and trials process.
Thank you, Dr. Sharavanan. So if we have a look at how these vaccines work and how do these trials work, we can see that the development of the vaccines has actually happened due to the research that has happened with the previous viruses that we have, such as SARS and MERS. So using that information and that research means that we're able to create these vaccines at a much rapid rate. So how do these trials work? So we have phase 1 of a trial, which looks at the safety of the medication. So you're looking at about 20 to 100 healthy participants. And this is just to understand the safety of a medicine. Now, bear in mind, every single medication that is produced goes through exactly the same process that this vaccine has as well. So on to phase 2. Once we've established the safety, we look at what are the effective doses and what are the side effects. And we do that when we do versus a placebo as well. So what that means is you have the drug versus a dummy drug, okay? And that's tested in approximately hundreds of people. And that's, again, just to see how effective and how safe it is as well, and what are the side effects. Then we move on to phase 3, when we look at thousands of patients across the world and for a prolonged period of time. So again, this is looking at the side effects, the efficacy of the medication, as well as what the effects are versus a dummy medication, or the best treatment at that particular time for that particular condition. Once they pass all those 3 phases, then we move on to phase 4, which is looking at regulatory approval. So this is what we term the MHRA approval. And this is when the medication then moves into the general population, but it is still monitored through something called the yellow card system. So every brand new drug, brand new vaccine, everything like that, the side effects, if you experience any, can actually be reported through the yellow card system. And any healthcare professional or any member of the public can report these. So the current vaccines have got temporary regulatory approval, and this is allowed under the emergency situations, such as the global pandemic. So what do vaccines actually do? We have a lot of talk about these vaccines. We've had them since we were babies as well. But what do they actually do, and what are the different types of vaccines that we actually have? So there are many different types, from live attenuated vaccines to dead vaccines, to those which use genetic material. So there are many, many different kinds of vaccines that you get. And these vaccines are using genetic material. Now, that doesn't mean that the genetic material alters your DNA in any way, but what it means is that it allows the body to replicate those proteins so that it can recognize the virus if it does enter your body. And what that means is that the body is ever ready to combat it with its soldiers in case the virus ever comes into contact with your body cells. So this means that actually your body is able to develop the defense mechanism a lot faster and causing less severity of illness. So this is a very good response that we get. So the question that we get asked a lot, well, which is the best vaccine? Should we go when we have the Pfizer vaccine, which you can see here, or when we have the AstraZeneca vaccine, or commonly known as the Oxford vaccine? So between these, there is no best vaccine. Both will protect you. So we predominantly have these 2 vaccines in circulation at the moment, and they both provide immunity to the coronavirus. So Pfizer uses mRNA, which is the genetic material. And the trials were conducted in 6 countries and included 44,000 participants. AstraZeneca also uses the genetic material, but that's enclosed in a viral vector that is used to deliver the vaccine into the body. And the trial here had 24,000 patients. And they do not contain any animal products. And again, nor can it alter your DNA as well. And that's a question that I get asked quite a lot. It also doesn't contain any of the coronavirus itself. So it can't give you coronavirus as well. So When we move on to talking about each of the vaccines which are currently in circulation. So with the Pfizer vaccine, you will have heard that you have to store them at minus 70 degrees in a freezer. Now, this is quite common for hospital sites to receive. If you're at a GP surgery or a mass vaccination center, then they will already come thawed. And they have to be stored in the fridge at 2 to 8 degrees for up to 5 days. So they have to be used up quickly, which means that when you do get an appointment for it, it's really great if you turn up for it, because otherwise we have to find spare people to then have the dose as well, because no doses are allowed to go to waste. So with the Pfizer vaccine, the genetic material is actually enveloped in 4 layers of lipid. So therefore it has to be handled with care. It can't be shaken or stirred. So once the Pfizer vaccine is made up, it has to be used within 6 hours. Otherwise, it has to be discarded, because what happens is that those lipid layers can then disintegrate. The dose is 0.3 mils, and it is given in the muscle of your upper arm. So, and what's happening at the moment is that whilst Pfizer are actually ramping up production, there is limited supply currently, but there is enough supply for the future for the second doses. You do have to wait 15 minutes after you have received this dose. That's because there were some reports of people having anaphylactic reactions. So by law, you have to actually stay within the building for 15 minutes after you've received this dose. This is just in case anybody faints or they have an allergic reaction or anything like that. So after you've had the second dose of the Pfizer vaccine, it has 95% efficacy. The second dose would be administered after 12 weeks, but the allergy status of yourself is very important to determine whether you can receive this vaccine. And we'll go over those allergy statuses a little bit later on as well. When we're looking at the AstraZeneca vaccine, this one also is stored from 2 to 8 degrees in the fridge, and it can be stored for up to 6 months. And it doesn't need to be made up, so it's drawing it straight out of the vial and then administering it to the patient. It has to be used within 6 hours once the vial has been punctured, and the dose is 0.5 mils. Again, it's given in the muscle of the upper arm. But for this one, there's no need to wait for 15 minutes within the building. But what you would have to do is wait 15 minutes in the car before you start driving. That's just in case you feel any kind of lightheadedness or dizziness or anything that might cause any kind of danger when you are driving. So you should stay in your car for 15 minutes before driving. And for this one, the only allergy status there is that you have to make sure you're not allergic to any of the ingredients that are contained in the vaccine. And when you go to the vaccine center, they would ask you these questions about the allergies, and they would have a list of those ingredients for the vaccine available so that they can cross-check as well. So with this one, there is 73.43 efficacy after the second dose. The second dose is after 12 weeks again. And this one is the better one to have if you have multiple allergies, and you have to carry adrenaline for that as well. So for those allergy statuses, the AstraZeneca vaccine would be best. And it's just it's probably just good to note here that no vaccine is ever 100%. So these are actually good efficacy rates to protect you. And what we mean by that is what I described before, is that whilst you may have the vaccine, that doesn't mean that you still can't get coronavirus. But what it does mean is that if you do get coronavirus, then those symptoms that you get and the severity of the illness will be less. And it has shown now, there's more emerging data to show that it actually is reducing hospital admissions as well. So back over to Dr. Sharavanan to have a chat about the allergy status.
Thank you. I mean, one point that I would add when you're talking about efficacy, if you try and compare it against sort of other vaccinations that we're already sort of more familiar with. So if you think about something like the annual seasonal influenza vaccine, for example, that has a sort of efficacy rate ranging from sort of 50 to 60%. Or if you think about something like the BCG vaccination, which is there to try and protect against tuberculosis, I would say that that also has an efficacy rate ranging from sort of 50 to 60%. But it's still extremely effective at being able to prevent TB infections and therefore prevent transmission of TB infections as well. Certainly, if I were to compare these vaccines, I sometimes actually call a BCG a much more sort of angry vaccination. I know that I've got a BCG scar on my left upper arm, and I know that my two children have actually got the same scars on their arms from when they were vaccinated as babies as well. Comparatively speaking, I would call these vaccines far more tame, far more calmer in their way, compared to something like a BCG vaccine, which actually most of us have probably had, and most of us are quite keen and happy for our sort of children and babies to have those. So I mean, just a word about talking about allergy statuses. You know, I'll reiterate what Sister Nirali has said, saying that, you know, both of these vaccines are quite stable, quite safe. And as a safety precaution, you know, patients who have had the Pfizer vaccine, they are being monitored for about 15 minutes on the vaccination site before being allowed to leave. Really, it's a question of saying that any patient who has a history of serious allergic reactions, anaphylaxis, who carry around an adrenaline pen or an EpiPen, these patients should really be considered for the AstraZeneca Oxford vaccine. In terms of side effects, by far and away the most common sort of side effects is you know, having a sore arm, feeling tired. Less commonly, you know, some patients are having things like headaches, mild fever, chills, but usually these are short-lived, only for a few days. And certainly the benefits of protection from hospitalizations, preventing complications from serious disease, and preventing deaths far outweigh any risks associated with vaccination. I will ask Sister Nirali just to say a few words about the other potential vaccines that are on the horizon for deployment.
Thank you, Dr. Sharavanan. So there are some more vaccines which are going to be coming out as well. So we've got the Moderna vaccine, which has got regulatory approval now. So we're just waiting for that to be shipped over and have the guidance actually set out. So that's another vaccine to add to our arsenal. This is also used with the mRNA. Like the Pfizer is using the mRNA as well. So it bears some similarities to that. So watch this space for the Moderna vaccine as well. So they have been ordered. We also have the Novavax vaccine, which is currently in stage 3 trials, and they've shown an 89% efficacy as well. So that's coming in the pipeline too. And then finally, we've got the Johnson & Johnson vaccine, which is probably the latest one that we've heard about. And the good thing is that this one can be stored at room temperature, which is great. It has 66% efficacy at preventing symptomatic cases, and they haven't shown any kinds of hospitalizations or death. So those are all positive things coming our way as well. So now, what happens next? What happens next is it's entirely up to you. The choice is yours. So we've been able to provide you with some information about the vaccines, and we understand that there are concerns about receiving the vaccines as well. But what we hope is that with the information that has been provided, that you'll be able to make an informed decision and be able to decide whether you want the vaccine, whether you don't want the vaccine, or whether you've got more questions, which are even more welcome. It's always best to be informed so that you know you're making the right choice for yourself, your family, your community, and you know, do that research as well. So what happens now is you probably may have already received a text message or letters from the NHS or from your GP surgeries. Now, what's happening here is that clusters of GP surgeries are coming together and they'll be vaccinating from one site. So this is called the vaccination hub. There are also mass vaccination sites at larger centres, which are inviting patients to come and have their coronavirus vaccine as well. So make sure that all your details are up to date with your GP surgery. If they don't have a mobile number or a home line or even an email address, then you won't be contacted as easily as they could. If you don't have a mobile phone, then some GP surgeries are asking for the contact details of sons, daughters, or anybody who else has a mobile phone number for which that they can send the text message to book your vaccine in. And if you're unsure whether you are due to have the vaccine now, then you can call your GP surgery or your practice pharmacist, and they'll be able to tell you what cohort you're in, so that you can book your vaccine in as well. Unfortunately, you don't have a choice which vaccine you receive unless there's a reason why you can't have the Pfizer vaccine. For anybody who has had their first dose of vaccine and they had a reaction to it, then it's likely that what will happen is that you'll be invited to go to the hospital to receive your second dose, so that you can be observed for a longer period of time as well. And that's some of the things which are happening around the country as well. So back over to Dr. Sharavanan to have a bit of chat about the cohorts.
Thank you. So this may be a list that you may have seen and may be already familiar with, and this is the priority risk groups for the order of coronavirus vaccinations. What I would say is that it's split into two phases, and this is phase one, and these are the 9 groups. Essentially, the plan is to get all patients who are aged 50 and above, or those with complicated medical background conditions, vaccinated by the end of April. The further target is to get all adults, so all of those patients who are, all of those people who are 18 plus, vaccinated by the autumn time, and that's really that's the sort of targets after that. I know that at the moment we have gone through our group 1, 2, 3, 4 patients. So these are patients who are 70 years and above, and patients who have been shielding as well are included within that group 4 category. And we've started working on our group 5 patients in our local area. What I would say is that, I would reiterate the point that when you get invited, please do make sure that you take the appointment and you take the earliest available. As we've already said, when we get delivery of something like the Pfizer vaccine, the clock starts ticking. The 5-day clock starts ticking. We need to make sure that every single dose is used in the correct way, and none of it is wasted. So when you have been vaccinated, I'd advise, make sure that you're resting well, that you're staying well hydrated. There's absolutely no harm, and maybe it's a good idea to take some paracetamol as well. My advice would be is that you keep safe, and you come back, and make sure you come back for your second vaccine 12 weeks later. The plan essentially is that you will be invited in a very similar way that you were invited for your first vaccine. And really, my request would be is that you sit and speak with your friends, with your family, and your communities about your vaccination experience, and really be quite honest about it. Be honest about the booking process. Be honest about how things were when you got to the centre, and if you experienced any side effects as well, be honest about that as well. To be very honest with you, I've had the privilege of working in my local vaccination hub, and I have to say that it was an extremely positive experience getting vaccinated, as well as working in the hubs myself. So, if I ask the question, Sister Nirali, have you been vaccinated?
Yes, I have been vaccinated. Have you been vaccinated?
I've certainly been vaccinated. You can probably see my badge that I wear everywhere now. I have to say, you know, I feel very honored, privileged, and lucky that as a healthcare professional, I was prioritized for vaccination. I had my Pfizer vaccine on the 11th of January, which is about 6 weeks ago now. I'm very grateful that I have this protection for myself, for my team, for my patients that I see face to face, for my family at home, and my broader community. I'm really happy to state that the whole of my practice team, from reception to management, from nursing to all of the clinical staff, have all been vaccinated. I will be honest when I say that we had a few members of staff who were vaccine hesitant, but through regular reminders and constant encouragement, they all got the confidence to be vaccinated. And I cannot tell you the peace of mind that it gives me as a GP partner and employer, knowing that they have all been vaccinated. For my Sai family watching this, my advice to you is clear, that when you are invited, please be vaccinated. If you feel it is safe for you to volunteer at a vaccination hub, then please do so. There is a need, and we are all very well placed to shower every single patient who attends these vaccinations hubs with Bhagavan's gentle touch and love. It is a wonderfully positive experience, seeing so many of our community's most elderly, frail, and fragile coming out to be vaccinated and protected. It is a powerfully empowering feeling of taking back control of our lives in the fight against this disease. If you think you are not safe to volunteer, then that's okay. You also have important work to do. Stay at home and stay safe. Come back in 12 weeks for your next vaccination. But in the meantime, spread the positive message to your family, friends, and community that you have been vaccinated, and tell them your experiences.
Thank you, Dr. Sharavanan. So let's all do our bit. Let's stay home. Let's protect each other, protect the NHS, and save lives. If you do choose to go for your vaccination, then please be patient and be kind to the healthcare professionals. We are working tirelessly for the public safety, and queues and waiting times cannot be helped sometimes. We do try our very, very hardest to try to figure out how to keep the queues down and keep the car parking going and everything like that. And also, please bear with us when there are queries, because the rules and the laws are constantly changing whilst we are working as well. So please make sure that if you do go for your vaccination, that you do dress warmly, wear your coat, scarf, gloves, hat, everything, and stay warm and stay safe. Thank you all very much for listening to this webinar, and we'd like to open the floor up to any questions, additional questions that you may have. And we hope that this has been informative and that it has helped you to think about whether you would like to have the vaccination. Saram.
Really excellent content on a very important topic. I think just prior to asking a few questions that have cropped up, I'd just like to give a little personal experience. I've had my second dose today, and I think there's a lot of anxiety around sort of the organisation and logistics of how the vaccine's rolled out and what your experience will be at a vaccination centre. And I have to say, it's very, very well run. It's organised. It's safe. You don't feel at any one point that you're cramped or pressurized to have your vaccination. So overall, the experience on the day of having your vaccine is very positive. So I think it should reassure all of us that when we have our vaccinations, it's in a very well controlled environment. The first question that I think will roll out is probably one that is very, very at the foremost of everyone's mind at the moment, and that is if the vaccine is protective against all forms of the variant of COVID-19. Are either of you able to shed some light on that?
So I mean, I think when it comes to the variant, I think that the evidence is still being gathered as to which of the vaccines are going to be to be able to protect against them. If we think about what's happened in South Africa, one of the concerns was the South African variant, which they are facing there. They had 1 million doses of AstraZeneca vaccine, and there was a very small sort of early study to suggest that the AstraZeneca vaccine may be less sort of effective at protecting against coronavirus. I think that it's an important point to raise when we talk about efficacy. What do we actually mean? First of all, we want to make sure that a vaccine protects against deaths. Then we want to make sure that it's protecting against hospitalizations. We want it to protect against severe disease, and we want it to then protect against symptomatic mild disease. And then ultimately, we also want it to protect against transmission. And really, it needs to be stated that when it comes to any of the COVID vaccines that have been authorized so far in this country, that all of these vaccines are effective against all of the variants, against the main two, which is in terms of protecting against deaths and in terms of protecting against hospitalizations as well. So, of course, the main variant which is causing issues, problems, and concerns in our own country here is the Kent variant, and certainly the vaccines that we have available, have been shown to be, very effective against the Kent variant that we have here.
Just to add to what you're saying as well, there's what the companies are also doing is making sure that the vaccines are tweaked to actually include that the variants are also covered as well. So that is an ongoing thing that the drug companies are doing as well. We do know that there is some degree of protection against those variants, but as Dr. Sharavanan said, it's still emerging data.
One other question that has just popped up on the feed is, can you have the vaccine if you've had COVID?
You can have it, but you have to wait 4 weeks after you've had COVID before you can actually have the vaccination. So that'll be one of the questions that you actually get asked at the center is, have you been COVID free for a month? Have you had a COVID test? Have you ever had COVID? So those are the questions that they'll ask before you get the jab. So it's a few screening questions that they ask you before you receive the jab to make sure that it's safe for you to receive.
And on that, your treatment regime stays the same of the two vaccines, 12 weeks apart?
Absolutely, yes.
Yeah.
Great, thank you. Another question that we have is, if the virus comes again in the future, can this vaccine have a fatal reaction with that? Is there any thoughts on that?
I mean, what I would say is that there is no sort of understandable or logical sort of scientific basis for a vaccine that we're giving now to have any kind of sort of serious reaction like that. In the future, there's nothing to logically say that could happen. And I think that, if we think about sort of regular vaccines that we give at the moment, I say that every single year we have a seasonal influenza epidemic. We never really describe it in that sense, but this is a respiratory illness that we try and protect, which causes a certain number of hospitalization and deaths every year, and a certain number of preventable, hospitalizations and deaths every year. All of this now sounds very, very familiar when we're talking about sort of COVID, because it is a respiratory illness, and we're trying to roll out a vaccination which is there to try and protect, trying to prevent sort of hospitalizations, and death. So we, when we are giving these flu vaccines, that there's nothing to suggest that there's any sort of longer term sort of side effects issues or concerns. So there's nothing logical to suggest that would be the case.
Thank you very much. Another thing that I think is in the context of a global pandemic, which we have never experienced before, and the rush to have the vaccine produced within a year, which is actually a phenomenal effort and has never been done in the context of viral illness before. It does throw into light the politics of vaccine rollout. There's recently an article in The Independent in December that has made people slightly wary of how this logistically has been rolled out by the UK government and countries in general. Essentially, the government granted pharmaceutical giants such as Pfizer legal indemnity, protecting it from being sued, enabling the virus vaccine to be rolled out, extremely promptly within the UK. Is this normal practice, and do companies usually seek legal indemnity in situations like this?
So I'm quite happy to pick up this question. What I would say, I'm glad that you mentioned politics, because I was going to say that there is a political warning with this answer. I think that we need to, if we compare, one thing I will say as a frontline GP is that I'm profoundly grateful that I have vaccine in hand to be able to give to my patients. And I can only be grateful to the leadership above me for their ability to be able to secure that for me so that I can give it to my patients. If we look across the channel at what's happening in Europe at the moment, that they're simply not in the same position as we are. And they followed a very different sort of pathway in organizing contracts and organizing their sort of authorization, for the vaccine. One of the things that needs to be said is that by the British government, by giving this indemnity, they were able to secure contracts, and they were able to secure sort of early supply, protected supply. And that's something which is, a very, very positive thing, for us in this country. The second thing that I would say is that actually the number of patients who actually come to harm as a result of vaccination is actually extremely, extremely small. So the number of patients who will actually get to a point where they need to take advantage of any such indemnity scheme is also extremely small. So you could argue in terms of politics that it is a little bit of a clever and cunning move to be able to secure sort of early supply of a vaccine that's in extremely high demand, as we have seen play out over the last few weeks and months.
I think the question comes into who therefore becomes accountable, and I think because the government has granted that indemnity, then therefore it would move to the government to have that. And we've seen that happen in the past before as well.
Just a follow-on question and comment on that topic of politics versus public health now. The question comes to mind of the initial data suggested the second dosing to be given after a period of 6 weeks, which then got pushed back to 12 weeks. This was based on not very much evidence that was available, but on the balance of public health safety. Do you encounter this question a lot in your clinical practice? And secondly, what are your thoughts on the delayed second dose rollout?
So yes, we do get this question quite a lot in clinical practice. We've seen now actually from the studies in Israel that having the dose 12 weeks apart has conferred really good immunity. So it actually has, so from the Israel study, they've had 95.8% reduction in hospitalizations by having that second dose spaced out by 12 weeks as well. So we know that the evidence, again, is slowly emerging that actually having the doses 12 weeks apart enables the body to kind of get used to the vaccine. And so when you have your second dose, it actually builds up your immunity further.
I think my own sort of personal opinion on this, I think that Professor Van Tam, who I think we've all sort of come to know during this, I think gave a very good example. If we've got two grandparents and we've got two vaccines in our hands, do we want to give, one grandparent sort of 90% protection or each of them sort of 70 to 80% protection? And I think that when it comes to that kind of decision making, when we then draw that out to a population, a population of patients, it feels uncomfortable to do it without evidence, but actually on the basis of sort of solid, sort of theoretical basis, I think that it's reasonable, and I think it was a good idea. And I think, as Sister Nirali is saying, as we're looking at the evidence and as we're observing the vaccination rollout and things, we can see that actually it was a very sort of prudent move to try and get as many patients covered with the vaccination as possible during what is still the winter season at the moment.
Thank you for that. Moving on, could you clarify the stance following sort of comments from the CDC in the US, which essentially said that the vaccine protects the person being vaccinated only, but doesn't stop the spread of COVID-19. How true is this? And is it possible to still be a carrier of the vaccine even if you've had the vaccination yourself?
So we've seen that actually we're getting more and more transmissibility data, and it is showing that actually it is helping decrease the transmissibility of giving COVID to somebody else, as well as protecting yourself. It does mean that you are kind of protecting others. But again, this is emerging data, and we can see probably from the REACT study. The REACT study is constantly being updated, and this basically looks at transmission of COVID in the community. And it's looking at hospitalizations and it's looking at deaths, and that's constantly being updated to see what is the situation in England. And since these COVID vaccines have been rolled out, we can actually see that there is a decrease in transmissibility, decrease in hospitalizations, and decrease in severe illnesses as well. But we don't have a figure as yet what that transmissibility data is. We just know that it's going down.
Yeah, I mean, I think these were comments that were made by Dr. Anthony Fauci, who's a US top infectious diseases expert. He's a very well-respected clinician. He's 80 years old and he's advised 7 US presidents in his time. And I think he was recently given a prize for defending science, for courageously defending science in the face of uninformed opposition during the challenging COVID crisis. So I've got a lot of time for what he's got to say. And I think, as Sister Nirali is saying, if you actually look at the timing of what he was saying and when he was saying it, it was actually quite some time ago. And certainly it was a question of saying that there was no evidence to suggest that it would reduce transmission. And I think that we need to look at that no evidence. No evidence does not mean that therefore the opposite is true. It's a question of saying that there is no evidence to say that it will reduce transmission, and there's no evidence to say that it won't reduce transmission. Whereas actually in theory, with nearly every other vaccination that we look at, in theory, it's a question of saying it should reduce transmission. And as Sister Nirali is saying, the ongoing observational data that we're looking at the moment is suggesting that there is a reduction in transmissibility, which is also there, which is really the one of the last things that we're looking for a vaccination to do. So it is encouraging. I think if you were to ask him again what his thoughts were on this, he would give us some more, the most up-to-date evidence which is out there at the moment.
I mean, as frontline health practitioners, I mean, how much time do you really have to sort of analyze the raw data and studies for themselves versus, documentation and evidence from regulatory bodies such as NICE and others? I mean, how informed do you feel personally as frontline medics to do your job based on the evidence that you feel is reliable and relevant versus what you're being told? How confident are you in the process?
So for me personally, I think it's one of my key jobs as a pharmacist is to kind of evaluate the evidence and critically analyze the papers, the trials that have come out, and question it as well. And I know myself and Dr. Sharavanan, when we first were looking at the COVID vaccination rollout and looking at the data, we were both like, oh, what does this say? We need to wait before we advise anything. Let's see what the data says. And, we both went through all of that. It's one of the first things that we do is actually, have a look at that data, then have a look at what the government says. Does it align with what the data says? Ask those questions. And actually, I think one of the good things that the government has done has given us direct access to those people who are in the know about the rollout, about the data. So they've been really good in doing that. So if we do have any questions, oh, what about this? What about that? We've been able to ask those experts directly, and they've been able to respond to us directly as well. We're truly grateful for that. So, there's always lots of time for it. And we do work overtime because we recognize that this is a global health issue, and we recognize that it is our duty to make sure that even the actions that we take are for the benefit of the public, and that requires us to look at that evidence, look very deeply into it, to make sure that we're always taking that right course of action.
One brief point that I would make in this regard is that certainly as a general practitioner, I think that we're, generalism is our specialism, and we're sort of expected to know something about everything, and it's just not, it's simply not possible for me to have the answer to every question that is posed to me. And I think it's about making sure that I sort of have access to sort of groups of specialist opinion, as well as sort of regular sort of free access to, sort of reliable sources of information. I think especially when I think back to sort of shielding, who should be shielding, who shouldn't be shielding. We really had to drill down. There was general guidelines, and then there were specific, Royal Colleges and speciality organizations like the British Society of Gastroenterologists, who would really sort of drill down. When they're releasing statements, I know that there are reliable statements that I can rely on, because actually, a panel of specialists has actually sat down, analyzed the data specifically, and then really condensed it into a usable form for us, really on the front line. And even pre-pandemic, this is what we do. This is naturally what we do. We look we're very fortunate in this country that we have a network of sort of reliable speciality organizations, as well as sort of organizations like the National Institute of Clinical Excellence, NICE, whose simple job is to analyze all of the evidence and to really critically drill it down into a usable form that we are able to reliably pick up and use. I'll give a brief example. I think that I wanted to look through all of the guidelines relating to diabetes, and I think that the total document ran 700 pages, whereas the guideline itself, was in a much more condensed sort of few pages that I'm able to sort of pick up and use. And I guess if I needed to really drill down on one question, I can go into that 700-page document and look for the specific papers that they've referred to be able to answer sort of my own professional curiosity to analyze what they've looked at. But we are fortunate in that way that we have dedicated organization and panels to be able to condense that information for us.
And they also update all the time. So one of the guidance that we predominantly use is the Green Guide. So the Green Guide, which is accessible on the government website, that's continually updated for any new guidance that comes out, from the immunization committees and that sort of thing. And they've been in a timely manner, which is incredible work, actually, to be able to disseminate up-to-date information in time for vaccinations. And we're talking about, the next day, the morning of, And it's an incredible work that's been going on to give us the guidance on the ground of how we need to operate.
Thank you for that. It's really important and useful for us to know. Just coming on to the last couple of questions. From the patient perspective, can the vaccine react with any medications that as a patient I may be taking?
So it doesn't interact with any medications, but what you do have to be wary of is if you are on any blood thinning medication, such as warfarin, apixaban, rivaroxaban, those sorts of things, then once you get your jab, you may or may not just bleed a little bit longer, like you would with any jab that you receive, whether it's the flu jab or anything like that, because the method of delivery is exactly the same. It's not that it interacts, it's just that the jab may kind of cause that kind of injury, if you like, to the arm, which may cause it to bleed a little bit. If you do have any kind of underlying illnesses, such as if you're undergoing chemotherapy or you're having rheumatology injections or anything like that, then normally what happens is that your consultant will advise when you should have your COVID vaccination. So some are recommending 2 weeks before, some are recommending 4 weeks, some are saying they need to have it sooner rather than later. So those are kind of individual cases for which that you would have to go to your consultant, and they would advise as to when you should have it, how soon before you should have it, your chemotherapy or your injection, and so on and so forth.
The other question from a patient perspective is, you very helpfully have spoken about the different types of vaccines, but if this vaccine works differently to other vaccines, as you've claimed, why are people experiencing COVID-like symptoms for a day or two after they've had their vaccine? Could you explain to us?
So what I would say, I mean, if we go back to, what we're looking for a vaccine to do, we are looking for it to challenge the immune system, to come up with a response, to come up with a defense against, what we're looking to vaccinate against. And I think in terms of the side effects that we spoke about earlier, I mean, I certainly had a sore arm and I was certainly tired. I certainly found that my son kept on running into my arm regularly, during the few days after I had my vaccination as well. But it's one of these things. I think that, you can get things like headaches, you can get things like a low-grade fever, and you can get things like chills, but they usually are short-lived. They last a few days, and then they wear off. Certainly one question that I've got asked is that, if you develop a low-grade fever, fever being one of the COVID symptoms, should you therefore go and get a COVID test? And I think it's what I would say the stress is on low-grade fever. So if it's a low-grade fever, we can safely assume that it's a vaccine reaction and the vaccine doing what we want it to do. But if it is, if it is a high-grade fever, then certainly it's worth sort of calling 119 and having a chat with the NHS system to see whether a COVID sort of test, a formal test, would be suitable in that situation.
Just coming on to the last question and probably statement, really. Obviously, as Sai devotees, we have Swami's grace that overlies everything that we do and live by. But as healthcare professionals, I mean, how much faith and trust do you have in the developers and companies that create this vaccine? How important is it to look at the developers and the companies' track record of integrity, honesty, and reliability, really, in things they produce? How important is this to you as people on the front line delivering the vaccine?
It's always very, very important that they do have that level of integrity. But we also can't forget that these companies also make all the other drugs that everybody is on. So the same level of scrutiny, the same level of integrity and everything, comes into consideration then as well. So, do I trust it? I trust the evidence. That's what I say. I trust the evidence. I know people who work for the pharma companies, and it is hard work that they are doing to make sure that everybody is safe. I mean, their primary aim is to make sure that there is something to protect the world, and for that we're grateful for that. But like you said, the integrity is very important. And there have been situations in the past, but the difference now is that people do get held accountable. And I think that's the difference here in the medical field. We continually learn, we continually grow.
I mean, I think if I give a different angle on it, and if I say that, in terms of a real world answer, I will say academically, the academic organizations will rip each other apart when it comes to looking at these. I mean, it's completely ruthless. I think that, when Oxford University is saying, this is what we've produced, this is what we've researched, and this is what we're laying on the table, it really does go down with academic weight, and the world does sort of sit up and look at what, and really heavily scrutinize, because I think that any academic organization would love to be able to find a hole, in what Oxford has produced, and to be able to, punch a hole in it would be, something that they could chalk up for themselves. But the point is that scrutiny is absolutely, brutal when it comes to the academic world. The other thing that I would say is that, to be really frank and honest, these are commercial organizations. And I think that, if you have a product which is causing, significant harm or damage, then it's just not going to sell. They won't be able to, they won't be financially viable. And so I think it is, we do need to look at it, in terms of a real world answer as well. They're there to make a profit at the end of the day, and I think that they just simply wouldn't be able to do it, if they were, creating products that were causing harm, rather than good. So I'll give a slightly different sort of angle on the question there, a different answer on the question.
I think to support your statement, I think, the one thing I have to say is, the percentage of these people who are coming in with serious adverse events into hospital on the front line is negligible. So I think what is being delivered by yourselves on the front line in terms of administration wise, when we look at the adverse events of, requiring hospital admission, it's minimal. So I think, it adds to the reliability of what's being, advocated by one and all in terms of vaccine and background of where they've come from. So it's just another thing to reassure everyone on the safety of this vaccine. So this, I think, sums up all the questions that have been put together, and the viewers have requested that need answering. So thank you very much to Dr. Sharavanan and Nirali for taking your time to answer these very pertinent and important questions. I'm now going to hand back to Dr. Sharavanan to take the session on forward.
Thank you. I wanted to introduce a video clip that was coming up next. I'm profoundly grateful to my elder brother, Dr. Jeyanathan, who is a consultant intensivist based at St. George's Hospital in London. In between an array of ITU and critical care shifts, he was able to find some valued time and effort to be able to give us a few of his thoughts from his unique position and perspective on the front line hospital in London.
Hi, I'm Jeyanathan. I'm a intensive care consultant at St. George's Hospital, London, UK. This last year has seen intensive care and critical care staff working in quite unprecedented circumstances. This nasty pathology that we have all as a world and as a nation had to respond to has tested the resilience, the very core of everything that is wonderful and brilliant in humanity. Intensive care is built on the entire specialty is built on the strength, currency, resilience, and the extraordinary skills and kindness of every intensive care practitioner, but especially our critical care nursing cadre. Whilst there have been a number of wonderful, heartwarming, extraordinary stories, and whilst there is a glimmer and glimpse of hope coming and emerging out of the second wave through the vaccination campaign, it is absolutely important that when we have the opportunity to have that vaccine, that every single person who's in a position to do so takes up that vaccine in a timely manner. This is not just a protection for each and every one of us, but also offers some important respite for the healthcare professionals across the National Health Service, as well as all of the support staff infrastructure that has had to stand up and work at full tilt for the best part of a year.
Jai Sai Ram. I wanted to give my personal profound thanks to Bhagavan, the National SAI Health Committee and the SAI organization for giving us this opportunity to be able to support the national and global effort in overcoming and defeating this pandemic. I would kindly ask Dr. Upadhyay to kindly give the closing statements for the session. Thank you.
Thank you, Dr. Sharavanan. I offer my humble pranam and heartfelt gratitude to Bhagavan Sri Sathya Sai Baba and thank to Sri Sathya Sai Organization UK, very dedicated media team and Sister Gayatri to arrange these health webinars during these challenging times by our healthcare experts on some very important health issues. I also thank Brother Jayesh Patel for a very nice introduction, and your brother, Dr. Jayashankar, to take some time from his very busy schedule to address the issue of vaccination. Also thank Dr. Rushi Nathwani for a very interesting and interactive question and answer session. You will all agree with me that these two presenters, Dr. Sharavanan and Sister Nirali, has given a beautiful presentation on this very challenging subject of COVID vaccination. You will agree with me that they both did a great job in explaining the journey of vaccine from the lab to the public in very simple terminology. I am sure this webinar will help you in making a very important informed decision to take the vaccination by removing the anxiety, doubt, and myth created by the fake media. And you can see the evidence that all these young doctors, they had their vaccination. And I thank to Swami that I also had my vaccination. Swami says, health is wealth, and be strong physically, mentally, and spiritually. Take care of your loved ones. Follow the national health guideline to stay safe. Your family and friends need you. So you have to be safe and healthy. Next webinar is on 2nd of March by a very renounced ENT specialist, Dr. Ram Bhaskar, on ear, nose, and throat. I hope that you will join that. God bless you all. Loving Sai Ram to you all.